Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
This Monday and last Monday. One of them talks about oral health and dental issues, and it raised a lot of questions that I wonder how we'd answer them. So I'm going to share some of them with you. For example, first one is after drinking a glass of orange juice or wine, what is one of the worst things you can do for your teeth? A, brush your teeth vigorously and immediately. Rinse your mouth with water. Rinse your mouth with a mouthwash containing fluoride. Chew sugar-free gum. Which of those four things you think is the worst thing you could do for your teeth?
Probably gum.
Any other answers?
Rinse with fluoride.
Okay. Any other answers?
Brush your
The
teeth
right.
vigorously.
Yeah, that's the answer because orange juice and wine are acidic and they can damage the enamel. And so all of the others are not as bad as brushing your teeth vigorously and immediately 30 minutes after you drink orange juice or wine. So if you drink orange juice or wine, you should give it at least 30 minutes before you brush vigorously. Second question, which of these beverages is least likely to damage your tooth enamel? Black coffee, lemon juice, soda, or sparkling water?
Sparkling water.
Any other answers?
Yeah, I'd say sparkling water.
Okay.
I also.
And the answer is black coffee. Because all of the others are acidic and likely to damage your tooth enamel. So black coffee is among the safest because its pH is more alkaline than acidic. Third question, what should you do immediately after brushing your teeth? Rinse your mouth thoroughly with plain water. Rinse your mouth thoroughly with salt water. Rinse your mouth thoroughly with alcohol-based mouthwash. And finally, do not rinse at all.
Salt water.
I say the
Plain
last
water.
not rinse.
I read somewhere that you should not rinse at all, and I was wondering about that.
And I have started doing that.
Yeah, and they say the best answer is do not rinse at all because fluoride is very good for the teeth. And if you brush your teeth with fluoride, then you want it to stay on as long as possible. So that they're suggesting that not rinsing at all is the best thing you should do after brushing your teeth. Many of the mouth washes have substance in it which kill bacteria, but they are suggesting that the best thing you can do is leave the fluoride toothpaste on your teeth as long as possible. Next question, which flossing technique do dentists recommend for cleaning rounded teeth such as molars? Flossing, back and forth, flossing straight up and down, curving the floss into a C shape, knotting or twisting the floss to remove more stubborn debris.
Mm.
Up and down.
And
This is Gina. Mhm.
yeah, welcome, Gina. Good to hear your voice again.
Thank you. Thank
Uh,
you.
They say that carrying the floss into a C shape around each tooth allows you to
Hmm.
get the matter removed.
C-shape.
What is one of the most important things you can do for good oral health? Use an electric toothbrush, use an electric toothbrush with sonic vibrations, use a manual toothbrush at least twice per day, or finally, any of the above.
Any of the above.
Any of the above.
Yeah, that's the best answer because all of those are good for you. This is an interesting question. Which of these conditions has been linked to severe gum disease? Alzheimer's, heart disease, type 2 diabetes, all of the above.
All of the above.
Yeah, that's right. All of them. So
Oh.
the moral of the
Mm-hmm.
story is to get keep your teeth in good condition because those severe gum disease contributes to all those. And finally, which of these conditions has been linked to normal use of certain mouthwashes? Seasonal allergies, high blood pressure, nearsightedness, or colored blindness?
High blood pressure.
Well, to surprise,
Seasonal allergies.
all of the above
Oh my.
have been associated with mouthwash, and this article strongly feels that mouthwash, while well-meaning, does not contribute well to oral health.
Wow.
Purpose of mouthwash really is to remove offensive bacteria, but they think that they also remove good bacteria, and so these people feel that mouthwash is undesirable. Next article that I thought was of merit is tough. Something, not anything that we don't already know, but emphasizes that exercise in midlife is very important. But the thing about it is that they did studies with how many 130 men and women in their 40s, and they studied them for the next 10 years. And they identified that those people who did exercise, their brain seemed to slow down, the aging slowed down. Whereas those who did not exercise, their brain seemed to deteriorate. They looked at the hippocampus where the memory lies, and they identified that the more exercise you do, more aerobic and weightlifting exercises you do, the younger your brain remains, and that when you start doing that around the age of 40, that while while most other people's brain ages, your brain is staying young. So they recommend that you exercise and appreciate the fact that the more you exercise within reason, and they are talking about 150 minutes a week, the more likely your brain is to stay young rather than to age. And so, and they say starting at the age of 40 is probably a good time to to do that because that's when the brain starts to age. So no, that was interesting. That's something that we haven't already talked about, but it further emphasizes the importance of aerobic exercise as well as weight-bearing exercises. Any comments or questions about that information?
Dr. Callender, Gina again. Can you say anything about the effects that very strenuous exercise has on men as in their older ages? Are there any
Well,
heart effects from that they should be worried about?
well, they don't talk about that. They say that the best exercises is the uh, aerobic and weight lifting exercise, but they're not talking about strenuous exercise because
Oh, okay.
they do not think that there's a place for the strenuous exercises in the older age groups. They just mentioned the aerobic and the weightlifting exercises and that are not strenuous. So,
Okay, thank you.
eh, yeah, any other comments or questions about that?
Dr. Callender, that article about dental, did it say anything about water picks?
No, it did not, interestingly. So far, I've not seen any articles that talk about water picks, which I use, by the way. Uh, and so I don't know why, but all of the dental articles that I've read or looked at recently have not talked about the merits of the water pick, which I think are valuable, except for the fact that if you use fluoride and you use the water pick, you're probably uh, cleaning out the fluoride, which you want to stay around and support your enamel. But to answer your questions, I haven't read anything about the use of the water pick. Darryl,
Yeah, just read on the internet. It says it's highly recommended to use your water pick before brushing.
before
Ah,
brushing. Okay. Yeah, which makes sense because when you use your water pick after brushing, you eliminate the fluoride. So that
yes.
makes sense. Gina, did you name what you say?
No, I said, yes. I agreed.
Yeah.
So
A good
what,
reminder.
Yeah.
so what I'm gathering from this article, we no longer need to buy mouthwash whatsoever, and we should wait a
That's
half.
that every article that I've read recently has come to the same conclusion. That's not good for the mouthwashing industry, but it's the conclusion that they've come to that the only thing that is not necessary for oral health is mouthwash.
And you should wait a half an hour after eating before you brush.
Well, I think if you use mouthwash just to rinse after eating is different from actually having that as part of your oral health effort. Yeah, because I think there's probably a place for it, as you mentioned. Darryl, you're on mute.
Yeah, I'm just reading where it says the ideal dental routine is the first water floss or string floss first. After that, brush uh, fluoride toothpaste for 2 minutes. Do not rinse with water after brushing. Instead, spit out the excess so that the active fluoride can continue to protect the enamel. And if you do use mouthwash, wait until 30 minutes after brushing so you don't wash away the toothpaste residue.
Thank you. That fits right into everything else. Thank you very much, Darryl. Any other comments? And then the third article actually has to do something that Darryl and the group discussed last week, which is the pelvic floor exercises and how important it is because as you age, one of the things that was mentioned early on was that aging is not for the weak of heart, because as you age, the muscles get weak, and as the muscles get weak in the pelvis, you have problems with holding your water and holding your fecal material. And so, in order to overcome that, they emphasize the importance of the exercises, pelvic floor exercises, and the Kegels, of course, are probably the one that have the most evidence that it works, and they also suggest you contract your pelvic muscles as though you're trying to stop the flow of urine for 8 seconds, then release, rest for 8 seconds, and then do it again. And they recommend squats, deadlifts, and pull-ups and push-ups to along with the so-called knack maneuver, where uh, you squeeze before you sneeze. You squeeze your muscles as though you're trying to prevent urine from leaving, and then you sneeze. Uh, anyway, so it's important, as we discussed last week, that pelvic exercises and squats and those kind of things will help the pelvic floor to decrease the likelihood of the development of urinary and fecal incontinence. Any comments about that? Because I thought that was followed up to what Darryl had discussed last week relative to pelvic exercises.
I've found out recently there's actually therapy for that, like going to a physical therapist for muscle pain or tightening. You can go for pelvic exercises.
That's correct. Yeah,
Mhm.
right. And that's good. Good for older people like us.
Like us.
Yeah. Okay. Dr. Perez,
And it
welcome
also
back.
it also fits well
We missed you
into,
last week.
oh, I missed you too. I was actually in John Hopkins ER, but anyway,
Oh,
which was phenomenal. Um, uh, it also fits into what we learned about how important sex is as we age and maintaining our pelvic floor for that enjoyment. And so it was one of the recommendations that I had from a gynecologist, and it works.
Okay. Thank you for sharing. Any other comments? If not, I guess we can start our articles. We have plenty of them today. Yeah, this is an article that shows, you can look at the graphic down below and see how trust in this CDC has plummeted as a consequence of the new administration. It's what is interesting is that it pretty much stayed the same with the Republicans, but everybody else lost faith in the CDC. But the Republicans remain confident in the CDC. Interesting. Uh, any comments about it? It's pretty clear that we know what's caused it. We've all experienced the new Secretary of Health and what he's done to cause us to distrust CDC. And but it's interesting that the Republicans really haven't changed at all, but the Democrats and the rest of the world has.
it's like the world has been turned upside down because they have um, they have caused an erosion of trust in these institutions that taught us about health and science and prevention of disease. And so, there are a lot of people who are way too gullible in this country and even abroad. You just put somebody who doesn't even have a medical degree in charge of the health and of the entire country, and people listen to the nonsense and see what happened in the military base in Texas. All those soldiers getting flu because it was optional to get the flu vaccine. And this thing in Africa, the Ebola outbreak in the Congo, we weren't prepared because we didn't share the resources. We withdrew from participating in prevention and then creation of vaccines. It makes you feel very ashamed to say that you're part of the American medical community when you see that all our protective help to other nations have been practically canceled out. And it's going to come and visit us on our doorstep one of these days.
Just a matter
That's
of
my
time.
feel.
Just a matter of time. Thank you for sharing. Janice, did you want to say something?
No, I agree with her.
Okay, well, let's go to the next article if there's additional comment about it. This is an article that talks about us struggling with prescription labels and how 1 in 3 are confused about them, and that's kind of bad because taking medication, the correct taking of medication, is very important to your health. And if you don't really understand how you're supposed to take your medications, then that's not a good thing. And they have 1/3 of us that really don't understand what prescriptions are. And if only 1 out of 3 took their medications properly, that's not good. So it's food for thought that we need to be sure that we get our prescriptions, that the pharmacy and the doctors make it plain in terms of how you're to take your medicine. Because sometimes it doesn't say what time to take your medication, whether to take them in the daytime, the nighttime, or whatever. And sometimes and it needs to be clarified so that you know exactly what medication you're taking in the morning, what in the afternoon, or in the middle of the day, or not at all. So we've got a long way to go to help our health literacy so that 3 out of 3 patients, when they get their prescriptions, they know when to take them, how to take them. And this becomes very important. But right now, it's 1 out of 3 still is confused about when to take their medications. And so this is something we have to work on. And they point out about the teach back method of you having your patient tell you exactly what they understand relative to when and how they should take their medications. Sometimes they think it's understood, but this article is making it clear that 1 out of 3 patients it is not. Any comments about this important information?
I know one
Okay.
one comment that I've had in my own um, assistance with providing some some health services for family members, and that is in filling trays with medication that needs to be taken twice a day. I have found that it's important if it's twice a day to make the distinction, even in filling the trays, between the AM and the PM, because unfortunately, um, some people say, okay, I'm supposed to take two a day, and they take it concentrated. So they're taking two pills in the morning instead of morning and evening. So they're really getting a higher concentration of the medication. I know we used to do it with adolescents, but I think it's really important that we also do it with seniors with lots of medication to take.
Thank you for sharing. I think it's very important information because we presume too much and we need to be specific. John Buchanan?
Yes, I've noticed that when I travel, I have to really focus on my medication. I remember one time I went to Martha's Vineyard and my medication was in my suitcase rather than in my backpack, and my suitcase was lost. It was misplaced. I didn't get it. I didn't get it for 3 days.
Wow.
Ah,
So, fortunately, I didn't really have any noticeable, really bad effects. But uh, what I've started to do now is put those meds in my backpack so that when I travel, I'll have them. And this next trip is going to be for 8 days. So the pill containers that I have only last 7 days. I have to buy a whole new container for the eighth day because again I have the AM and PM medications that I need to manage. So I think it's a very good topic for concentration. Thanks.
Thank you for sharing. Sylvia?
Yes, good morning, everybody. It's funny because I was just at the Dollar Tree yesterday looking at those containers where you put your pills in. And normally you see one like Monday through Saturday. But this time I saw containers that said morning, noon, and dinner, which was something different that I had never seen. So, when you start thinking about what time to take your pills, maybe that might be something that could help. And it was just different. Morning, noon, and I think morning, noon, and dinner time. So it's a
Yeah.
different labeling of the containers, I guess, to help us to stay focused on when and how and what time to take those pills.
I think your points are so well taken about the importance of health literacy. Sometimes we take for granted that people understand what we mean, and when in point of fact we don't. And so it's important to take advantage of exactly what you shared with us today. Thank you so much. Okay, let's go to the next article. Well, this is a medication that isn't that common, but this is a recall of a blood pressure medicine that was recalled because they didn't think it was as effective as it should be. And chlorphallidol is not a medication that I have used, but it's a medication that has a long history of being used in the treatment of hypertension. But we've had so many iterations of antihypertensive medications now that for one to be recalled is not really a tragedy because there's so many others that can replace it. I don't know if anybody is on that medication, but anyway, they have recalled it because they didn't think it was desirable. They didn't go into specifics as to why, but they made some comments about the dissolution of the medication and failed dissolution specifications, uh, meaning that the tablets didn't dissolve according to the specifications that they felt was important. So they discontinued approval of it. Okay, let's go to the next article. It's not a common drug. So this is obstructive sleep apnea, which is a common problem, but they link it to higher muscle quantity and lower muscle quality. What does that mean? It has to do with the skeletal muscles are not being effective at allowing you to breathe effectively, and as a consequence, you inadequately receive oxygen, and this hypoxia, or low oxygen level, is what causes the hypertension and the other side effects that are associated with obstructive sleep apnea. But they're saying that it's a skeletal muscle, and skeletal muscle is the muscles of the body and next to the bones. That's why they call it skeletal muscles. And that when you have obesity that is associated with poor quality muscle, this contributes to obstructive sleep apnea. This is a tactical appreciation. I think the bottom line is the management for it remains the same, but it's just try to understand why some people have severe obstructive sleep apnea and some people have mild and some people have uh, moderate sleep apnea. But it's all has to do with the amount of oxygen that is administered to. Because when you have the low level of oxygen, then that causes all of the consequences of obstructive sleep apnea, which contributes to easy fatigability and hypertension and um, overall ill health in a significant number of our population, particularly people of color.
Dr.
Any
Callender,
other
if I may
questions?
interrupt? Yes. You gave us a little couplet at the beginning, sleep apnea. Did you find it as higher muscle quantity? And what was the second little phrase?
It
Lower.
said it said actually was related to higher muscle quantity but lower muscle quality. So
Quality. Okay. Thank you. Nice little thing to remember.
yeah.
Yeah, we have several people in our family that deal with sleep apnea, and it can happen very early. I looked at my son when he was just 25, and he looked like he was 35. He was so tired during the day. And once he was diagnosed and started the treatment way back before he even turned 30, his energy level just jumped up and he was so much more awake and alert and happier. So,
Thank you for sharing.
whenever, yes, whenever I see people who are resistant to the idea of starting on treatment with CPAP, etc., I have to share his story. It changed his life.
Thank you for sharing. John Buchanan has shared his story as well. So appreciate that. John, any comments?
Yeah, it's challenging. to put that unit on every night. But when I don't, I end up being really tired if I don't use it. So um, sometimes I don't use it if I take a nap, like an hour or 45-minute nap. I may not use it, but overnight, I think my sleep quality is a lot better with it. And my son has severe. I have mild apnea, so he has severe obstructive apnea, and my spouse has severe apnea as well. So even though they don't, well, she doesn't use the machine every night as she should. My son has to, or he won't sleep at all. All right, thanks.
Thank you for sharing. Thank you for sharing. Okay.
Yeah.
Any other comments, Gina?
Oh, no, thank you. I am, surrounded always by people who benefit from hearing that story because there's so much resistance, to using the CPAP. But it's good when we can share our stories of our own family members and tout the success of whatever treatment that there's and that's being recommended that people have resistance to. So the personal stories do help. And thank you for sharing your story, John.
Darryl?
Yeah, one of the things that can help sleep apnea is elevating your head by at least 30 degrees, using a wedge pillow or adjustable bed. Um,
Mm-hmm.
Most people don't raise their heads enough when they sleep, and it causes gravitational pull on the throat that contributes to sleep apnea.
Thank you for sharing, Darryl. The next article is about tonsil cancer, and this is uh, a young man who was surprised to find out that he had cancer in the tonsils, 46-year-old, which is related to HPV positive tonsil cancer, which is once again a reminder about kids taking the HPV vaccine early on in school and also as a young adult, because when you get into the decades of the 40s, HPV that you got back when you're younger causes auto head and neck cancers. And this is tonsil cancer is an example of it. And it talks about the symptoms of tonsil cancer with sore throat and ear pain and if you think that you have any trouble with swallowing or anything like that, one of the things they mentioned having bad breath because of the tonsils, the peritonsillar abscesses, swollen lymph nodes, any of those things. So it doesn't go away. Any of those things are reasons why you should see your doctor. And if symptoms do not go away, they can find out whether you've got tonsillitis, mononucleosis, abscess, or cancer. And it's as we have men and women get older who have been exposed to HPV younger in the age of 40, 50, and 60, head and neck cancers can occur. So this is to have people more aware. And if you have the symptoms that were discussed in the article, then you should see your doctor and get a biopsy if necessary, if the symptoms persist. John?
Yeah, this brings back nightmare memories. I had a tonsillectomy in a doctor's office when I was a kid, and I guess it was a local anesthetic. It was horrible. It was a nightmare. I ended up, I think, a couple of months later, being admitted to Children's Hospital, where I had adenoids and tonsils removed, and the only good thing was that I got ice cream at the end of it, like Bill Cosby. You know? But so it didn't mention adenoids, and it didn't mention what happens if you have a tonsillectomy. I was just wondering if there's a relationship. Maybe one of you guys know.
Relationship between what?
Having tonsils removed or adenoids. They didn't mention adenoids at all. With having cancer.
Right, because it's interesting because when they talk about tonsillectomies, they do not talk about adenoids, which is interesting because we often think of them together. But one of the things about tonsillectomy is that it is not often anymore an office procedure, but it is particularly if you have a peritonsil abscess and if you have recurrent tonsillitis that does not respond to treatment, then the surgery becomes essential.
I'm thinking that I had it because I snored as a kid.
Darryl, you are next.
Yeah, when we talked about HPV cancers before, we talked about oropharyngeal cancer, or the general category of throat cancer. So is this tonsil cancer? Is it just part of the oropharyngeal cancers?
Yes, it is. It's a particular type of head and neck cancer. That's a type of head and neck cancer. Okay. Joyce?
Good morning, all who I have not spoken to. When I was a few years ago, when I was in high school,
Yeah, a few years ago.
I had my tonsils removed, and I went to the hospital, but they say that they could not find any adenoids. What causes your adenoids to disappear?
I don't know much about adenoids, so I have to defer the answer because most often uh, they do tonsillectomies, and usually in older people, the adenoids are gone. So I don't know why. I just think as you grow older, uh, as you mature, the tonsils stay and the adenoids disappear. I guess I don't know why.
Yeah.
That's a good question.
Thank you.
I remember. I'm sorry, Joyce.
No.
I remember looking at surgical schedules when I was working in hospitals and or working even in the blood bank much earlier than that. When people were scheduled for tonsillectomies, it was always a T and A surgery, tonsillectomy and adenoidectomy. So is that still happening? That they always take the adenoids out too?
If
Does
they're
anyone
there.
know?
Yeah, if
Hey,
they're
if they're
there.
there, that's right. Case in point, Joyce.
Yeah. Now,
I
Just
have a
reading from
little
the
story if you don't mind. I'm sorry. Go ahead.
Yeah, just reading from the internet, adenoids shrink and eventually dissolve as you age because your immune system matures and develops more sophisticated systemic ways to fight off germs.
Uh-huh.
Thanks, Darryl. I did have a period in my life where I always kept colds, and that was because of the tonsils. And that's probably what happened to my adenoids, that they just got infected and just disappeared.
Anyway.
Thank you.
Mhm.
Okay. Any more comments or questions about this complication of HPV? Emphasizing again the importance of giving HPV, particularly to the males, when they reach the age of 5 and older, and of course
Fine.
the women as
Mm.
well. Right. Gina, you had a comment?
No, 5, I hadn't heard that that's when it starts. I'm sure
The
that's,
earlier the better. As soon as they
you know,
start having sex.
big change since I was studying that or recommending the vaccine. That's good. That's good.
No, I think before 10. But it's all about when do you think your children are involved in having sex? And so we don't know what age they start, but
Right.
when they start school, it's a good time to start vaccinating them with HPVs, particularly the males, because it's from the males, and the women get it, the girls get it from the boys. So the boys
Right.
particularly need to be vaccinated. The girls as well for their own protection, but it's primarily from the males.
But as
Janice,
usual, what do you call it? Drawback is the parents' resistance in certain communities.
I didn't understand what you said.
The big drawback often in getting the children their vaccines on schedule is, of course, the parents' resistance in certain communities.
Right, right. Mhm. That's correct. Yeah, the parents are the biggest obstacle. They don't think their children are having sex, uh,
Ever.
but uh, but that doesn't mean they aren't having sex.
Right.
Janice,
Yes, it appears recently we've been hearing about HPV. Have that always been an issue, or why is it we're hearing about it more now?
because we know we weren't always aware that HPV was so prevalent in head and neck cancers. We also didn't have the vaccine all the time. Now that we have the vaccine and we know that when you reach 40 and above, that it causes not only the perianal uh, cancers, but it also causes the head and neck cancers. So as we know more about HPV, of course, it all started with HPV is the cause of cervical cancer.
Mhm.
And of course, we then realized that that involved uh, cervical cancer in the young women, but it also involved the head and neck cancers in the older people, particularly males, and particularly males, yeah, for the head and neck cancer.
But okay.
And I think over the last 10 years, we've gotten a plethora of information that has informed us as the importance of getting the HPV vaccine as early as possible, and recognizing that its impact uh, can affect people at up to the age of in the 40s because they've had this virus all this time and it's been untreated and it then manifests itself later on in life. So it's an important lesson to learn. And of course, the other message is that the parents need to have their children vaccinated, especially the males, vaccinated early on in school so that they don't give it to the girls, and the girls would get the cervical cancer, and the men would get the head and neck cancer later on. Any other comments about the this more recent observation that we're sharing now. And it's so important that the grandparents share it with the children and the children with their children, so that the children get vaccinated when they're very young before they start sex, so they don't pass it on to the women, and women pass it on to the men and so forth. But it really starts with the young boys who's who spread it.
And it's so important for grandparents because to be part of the conversation, we know that the parents of pre-adolescents can't imagine their children having sex.
Yeah, that's the problem.
Yeah.
Yeah, they
Not
can.
my baby girl.
Well, what age do you think that they start having sex in school?
It's so young, I don't even want to think
Think about
about it. And we have to talk about not just intercourse, because I think it's that whole conversation about sex that we're unwilling to have, masturbation, all of those things that are associated with it. Yet we know that you can't be a living being, organism without sex.
Okay, thank you for sharing, Dr. Perez. Darryl, comments?
Yeah, I was just doing some research on what age children start having sex. On the average, the good news is still 16 to 17. You know, they're the outliers of
That,
children that
I
can
don't
have.
believe that for a minute. I don't
Well,
believe
that's
that for
that's
a
what the
minute.
that's what the research says. You
I
know, the
don't that, but
outliers are the kids
but I would not accept
start
that.
having sex with the onset of puberty.
No.
They say the average is
I think
16
that's
to
very
17.
inaccurate. I suspect that 10 would be the oldest I would think that they should start doing that, because 16 and 17, I mean, come on, that's way too old. They start having sex long before that. And I wonder uh, what studies that they're talking about that would say 16 and 17. Dr. Perez, in your practice, what did you find out with the kid that you
I'd say
dealt
about
with?
between 8 and 10.
Yeah, I would think that's more like it. 16 is out of the question.
Yeah.
Janice?
Strange we're talking about this. Just yesterday on the news, they were talking about a 13-year-old that raped two very young girls. The
Yeah.
question was, what do we do with them? Where do we put them? Do we put him in jail? He's not protected. It was the strangest thing I've ever heard. Well, not ever heard. But, how do you think about things like that? And we think about these young kids, but why would this young male rape children? I don't know what the outcome was, but that was part of the decision. You can't lock him up and put him in jail. And someone said put a house monitor on him for a certain period of time. Did anybody else hear that news article?
Yeah. Okay.
You did? Yeah. Strange.
Yeah,
Long
So
ago.
you don't know what these young kids are thinking.
but what is strange is why you can't put them in jail.
It should be some kind of punishment, but that was what the whole conversation was about. I eventually just turned it off. Um, you can't just say, pat him on the head, go home, don't do that again.
Darryl, any comments?
Yeah. Average age to lose virginity in the United States is generally between 17 and 18. Specifically, data from the CDC and the Kinsey Institute show the average is roughly 16.8 years for men and 17.2 years for women.
I don't
Wow.
believe. I don't believe that for a minute. But anyway, it's
Yeah.
interesting to hear the data.
Mhm.
May I make a comment?
Yeah.
So years ago, I was working with an adolescent group, and there was a young man who had some psych problems that led him to the psych unit for teens at Suburban Hospital. And on the unit there, he molested and I don't think he raped anyone, but he was really doing very unnatural things and harmful and, assaulting girls at night. He would get into their rooms. So he did actually end up at Crownsville, if you remember Crownsville. And that's actually where I met him. I was doing my psych rotation in Crownsville years ago before it was, what did they do? They shut it down, right? Yeah, so there are ways that they deal with children, and this guy, I think he was 15, but I'm not sure that incarceration is really the answer unless it can be loaded up with psych evaluations and therapy. I don't know if these kids are incorrigible at that age, that they can't be corrected, that they're not safe to be out in the world, free as they used to be. I don't know. It's a big topic because he's not an adult yet. What do you do with him? I share your worry about that.
Okay. Any other comments about this interesting problem? Darryl?
As an answer to that question about what to do with juveniles, they have juvenile lockups. So
Yeah.
for 15 up through 18. In fact, I think there was one in a facility that was 12, and he was a pyromaniac, used to set fires. Yeah, so 12 to 18, they have juvenile institutions at least in Maryland. I'm aware.
Yeah. I was actually very fortunate to work with Dr. Corder at Oak Hill for 3 years. There were some very interesting cases, and I'm forever grateful for her mentorship and for learning, getting this vision into the things that kids do, breaking the law and putting themselves at danger and others as well. That's my last comment.
Darryl, you had a comment?
Yeah, my comment is that HPV viruses, the prevalence is dramatically decreased among younger generations due to widespread vaccination. And of course, we're not there yet, but the vaccination has only been available in the last couple of decades. However, the diagnosis of HPV-related oropharyngeal and anal cancers have steadily increased across a broader population, and that's driven by changes in sexual practices and reactivation of latent infections. So, the popularity of oral sex, oral anal sex, and anal sex are driving the increases of HPV cancers.
Thank you for sharing. Dr. Cordes?
And some of that is miseducation. And I think there was a book that Oprah had a lot to do with. It's not what's wrong with you, but what has happened to you. Sexual practices, as we were talking about, we don't talk about them. And so, other than penile vaginal sex, is something that young people might have picked up to prevent a pregnancy, as opposed to the other consequences of the behavior or the whole issue of intimacy. What is it? We don't have that discussion, and why one would want to. Many of the children, many of the adolescents that I had that were sexually active before the age of 12 or 13 was secondary to abuse, and usually by somebody they knew continually. We think about the Epstein files and what we've known for decades, yet have not even come to the point that we want to fully disclose all of that. So, so anyway, and I've had the opportunity to work in maximum detention for adolescents in New York City, and the children are the same, in dire need of love and compassion and truth.
Okay, thank you. You have another comment, Darryl?
Yeah, to Dr. Perez's point about a lot of the outliers of younger ages involved in sex is coming from child sex abuse. The reported numbers are 1 out of 4 girls and 1 out of 6 boys have suffered child sex abuse. And it's like she says, is generally from people that they know, including family, educators, um, people in religious institutions. And so, it's not always, some of it is driven by young curiosity, influenced by social media, pornography, things like that. But there's a significant amount of it, of younger sexual practices being driven by child sexual abuse.
Thank you for sharing. Okay, all right. I guess we'll move on to the next subject. I think there's no additional comments. This is an article that's uh, strange in a sense that we're talking about artificial neurons that cause living brain cells to fire, which has never happened before, and it suggests that uh, this is a process which may begin to be used to activate actual living cells, nerve cells that were not firing before. And this artificial uh, substance will now cause these neurons to wake up and fire. The fact that this artificial process could actually result in neurons firing uh, has enormous repercussions in terms of activating by artificial means uh, nerve cells that seemed to be dormant before. How this will end up, I don't know, but it's something that uh, is phenomenal that we have identified a process for getting neurons that in the past were not activated to become activated. And it's not clear to me what are the ways in which this will affect people who've had amputations and have other reasons why the nerve cells are inactive, and whether this process will allow in the activation of those neurons. So that this could be a very seminal phenomenon that may begin some exciting stuff in the future. But anyway, the fact that real brain cells respond to artificial efforts is very new and exciting, but I don't know where it's going to take us. But just sharing that information that we've found a way to using artificial methods to activate dormant brain cell nerve cells. Any comments on this fascinating finding? Even though we don't know where it will lead, it has a potential of becoming helpful and because our research and ability to get neurons to work is not very good. So this may be the beginning of something special. Any comments on this phenomenal finding?
It's critical that DEI be included.
DEI, still using that term.
Diversity. Yes, 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 yes. People of color, women, I now have to say the elderly or seasoned people to provide wisdom to the conversation. We need that type of diversity. It's critical.
You're absolutely right. It's a shame that it's being discouraged, but it is. Okay, let's go to the next article then. Well, of course, this is not anything that's new to us, but increased dementia risk, bowel to processed food is something that we've talked a lot about on this space. And this just another study that links dementia. Of course, this is primarily in Australia, but it's probably is evident in the UK as well. And it's probably is evident in the United States. It's just that we haven't yet demonstrated it as well as they've demonstrated in this particular study. But it's no surprise to us, though. So, any comments about this not being new to us? But anyway, another finding of ultra-processed foods leading to dementia. Yes, Dr. Perez.
Yeah, I've seen a couple of commercials now where they're talking about ultra processed food for dogs, kibble. So, I mean, the word is getting out. I don't know if all our people are absorbing it, but the word is out there not to give your dog and cat ultra processed foods.
Well, the word may be getting out, but the marketing of it persists. And it doesn't seem to me as though the number of ultra processed foods has so far has changed much. So we shall see. Any other comment on this finding, which is not surprising to us? Any additional comments? No? Okay.
Right. I just want to take this weekend, which is usually celebrated with a lot of barbecuing and things of that nature, the sausages, and, you almost begin to salivate when you get the invitation. But we in our community do have to have that kind of discussion that we've got to change our diet.
Yeah. Talk is cheap. So we shall see. Any other comments about that? I guess we talk about it more than any other group I know of. This is an article that we've talked about as well, is a 10-hour eating window as a way of weight loss. And I think that I'm trying to see, trying to remember who it is that champions this for us. But thanks, Betty. Yeah. But anyway, this is demonstrating that having that 10-hour window is a way of losing weight as well as fasting. And that those who do calorie counting and those who use the 10-hour eating window, they still lose weight, but they lose weight by a different mechanism. And it doesn't appear that one way is particularly better than the other because they both are good at losing weight. But and that's the bottom line. The other issue, of course, is whether or not you have a sarcopenic effect. Darryl, you had a comment.
Okay, for anybody that missed the point, and just in case I missed the point and I need to be corrected, I think this 10-hour eating window means that you only eat within a 10-hour window. So if your eating starts at 8 a.m., then you don't eat anymore after 6 p.m. That's a 10-hour window. Is that's
Yeah,
similar to what Betty Blaylock has always
right,
said,
right,
that she doesn't eat anything after 4 o'clock.
right.
So the common sense part of this is that if you keep your eating within a window and you don't snack all night while watching TV, you're going to lose weight because that's a primary cause of gaining weight. That you just eat all day long. You gotta if you sleep 8 hours, that leaves another 16 hours available. So if your eating window is 16 hours, you're going to be as big as a house.
Yeah, well, I think that's pretty much the this article and others have also has a group that just fasts. They just count the calories, and they looked at the group that counted the calories, the group that had this fasting period, and they found that they all lost weight. Well, they just did it through a different mechanism, and they felt that the 10-hour window was associated with a pro-inflammatory gene expression, which is a reduction in that, which is desirable. And so they kind of suggested that might have been the superior to the other way, although both resulted in the loss of weight. But there was a hint that this might be more desirable than the diet counseling alone. But of course, the short study period and the small sample size. So I guess we can't make too much out of it, except to say that as we think of what Betty's been doing and successfully, that there's more than one way to skin a cat. But this TRE seems to result in favorable changes in gene expression. So time will tell, additional studies, but we know that our example that Betty has demonstrated to us has worked for her. So and it looks like it worked for a number of people as well. Any other comments other than Darryl's comment, which is very helpful? Okay, let's go to the next article. And this is an article that says the same thing, that fasting and caloric restriction work different pathways, and that you kind of pick and choose which you want to do. Of course, if you're a diabetic, this has the ramifications. Okay, let's go to the next article. Unless there are comments about these two articles.
Well, being somebody with the obesity gene, it's good to hear something other than just lose weight.
Yeah, yeah, yeah. This is an interesting aspect for people who have gloating, uh, need to have gluten-free diets and how it can affect your ability to sleep. If you have celiac disease, which means that you can't eat gluten-containing foods, and this then would interfere with sleep. Of course, this is only for those people who are sensitive to gluten. Most of us are not, but there's some who are. And this may disrupt, because of the bloating and abdominal pain and fatigue, it may necessitate a gluten-free diet, which I don't know if there's anybody on this call who actually requires a gluten-free diet so far. Haven't heard anybody admit to it, so it may not apply to anybody on this call. Because I think this particularly applies to those people who are gluten sensitive. Let's go to the next article then. Well, this is an article that really emphasizes what you eat more than anything else. As we have always been mentored by Darryl and others about the importance of having a plant-based diet is the healthiest diet that you can have, with emphasizing vegetables and fruits and relatively meat-free, although not totally meat-free, but certainly making it plant-based. And of course, one of the other things that it emphasizes the reliance upon sugar and salt, and how eating properly and will provide with a healthy outcome, and that most, just about everything I read these days emphasizes that the emphasis on a plant-based diet is the healthiest diet you can have, based on randomized and unrandomized studies, so that the types of food you eat to determine your health. It doesn't say that you have to become a vegan or you have to become a vegetarian, but it does indicate that the better diet is the plant-based diet. It doesn't have to be meat-free, but it certainly has to be vegetable, plant-based is the ideal diet. Any comments? Because we've talked about this time and time again. Darryl?
Yeah, my comment is that, as we all know, Sunday is the most segregated day of the week. And in the group sessions, the quietest segments of the group session are when we talk about diet. I talk about it because I like to encourage people to uh, to be more plant-based in their dietary selections. But in reality, this is probably the hardest thing to ever change because we're in love with what we eat. And this like these conversations hit like water off a duck's back. But if there's anybody out there who's willing to testify that making some changes in their diet has improved the quality of their life, it could be very encouraging to those of us on the group session to let us know that this is a meaningful discussion that we should continue to have, or is it just completely ineffective because we're in love with what we eat?
Well, I think I know I've been influenced positively by all of the comments you've made, and I've made every effort to try to make sure that my diet is more plant-based than ever before. So that I think that you've been very effective with teaching me. So I can't speak for anybody else, but I can speak for myself that my dietary eating has been changed dramatically based on some of your recommendations. And also, not only your recommendations, the fact that the literature is profuse with data that supports your position. John?
Yes, I've not become a vegan or vegetarian, but yeah, I have pretty much locked out all the beef out of my uh, diet, and even though I still like bacon and dairy products, um, I have a lot of vegetables in there and fruit and yogurt, and so it helps me to lock into that and not stray, because sometimes that double cheeseburger kind of looks good.
Any other comments? Okay, well, at least you got two of us who've changed our eating habits based upon not only your excellent comments, but the fact that it's all supported by data. Joyce?
Yes, I'm going to comment on that too. I have also, with your lectures and people's comments, I have made some changes to my daily intake. Right now, the basic thing that I drink is milk, and it's not, and it's basically 1% and 2% milk. But when it comes down to my regular food intake, I still eat the majority of the foods, but I do limit what I eat. And I don't eat them on a regular basis. What I can say that I eat on a regular basis are vegetables and fruits. Those are always in my diet every day. Meat is not something that I eat every day. Sausage and bacon and um, things like that, I have just about eliminated them from my regular diet, which I used to love bacon. And as a result, I have lost about 35 pounds. So I can see the benefits of limiting, not to say I have excluded everything, but I have limited the bad foods in my diet.
Well, thank you for sharing. So, Dow, your cause is not lost. Okay, all right. And I think this is interesting, the emphasis on the fermented foods and probiotics, and of course, the emphasis on vegetable fruits, etc. So, plus limiting the processed and sugary foods is still a work in progress. Okay, let's go to the next article. I just included this one because I thought it was interesting to have a patient to talk about 10 tips for cardiovascular prevention. One of the things that they emphasize is something that we tend not to appreciate, and that is that the South Asian population is has its own issues. We have ours. South Asians have theirs, and MI is one of the things that screening should be done at the age of 40. It's interesting, a lot of discussion when you should start all this stuff. Actually, I personally think you need to start looking for hypertension at the age of 12. But anyway, they're talking about looking out for MIs at the age of 40. And this emphasis on most of this is from the South Asian perspective, which is different from the perspective. And the BMI is something to look at. We consider BMI less than 30 to be normal, and they're finding that insulin sensitivity is the biggest issue. The triglyceride, the cholesterol level is something that we've mentioned before, but it becomes an even bigger problem for the Southeastern Asian. And then, of course, looking for type 2 diabetes and insulin resistance is a problem for all. And they talk about the coronary artery calcium scores, which are an issue because they have plaques as well. And of course, the score that you would like to have for coronary artery calcium score is 0. But that's something that we need to look at as well in all ethnic groups. And then the diet to the culture, of course, we have a problem because we eat so many ultra processed foods. And it's interesting because that was not their tradition until they came over here. And that has changed. And apparently South Asian women have the highest ischemic heart mortality among all Asian Americans, which is interesting to have a perspective that's different from the African American perspective. The dyslipidemia is something that they have more problem with than we do, but it's still an issue in all ethnic groups. And then, of course, the exclusion of the Asians from the clinical trials is that something that women and people of color have long recognized that they have in the past had excluded us. Of course, they excluded women at first, and now they've included people of all ethnic groups. So it's interesting to hear a different perspective for a change, how the Southeastern Asian population looks at all of these things a little differently than we do. So I thought I'd add this so we could have a different perspective. Any comments or questions as we go to the next article, unless there's a comment about this one? This is the last one, I think, because we're at 10:30 already. Electroconvulsive therapy response to depressive disorder persists for 12 months. It was interesting that this therapy has kind of disappeared for a long time. I remember that Paul Robeson had treatments for depression later on in his life. And for the most part, electroconvulsive treatments for depression are not talked about as much. But here you have a manifestation of resistant depression that is successfully treated by electroconvulsive therapy with positive consequences that lasted up to 12 months, which is interesting for the depression, particularly in the elderly, which has been associated with electroconvulsive therapy being effective. Darryl?
Didn't we used to call that shock therapy?
Yeah, yes, we did. Still do.
Like in the movie One Flew Over the Cuckoo's Nest.
Yeah, right. Right. And for the most part, it kind of actually disappeared. But for uh, depression that is resistant to treatment in elderly patients, it seems to have found a new home. I don't know if, well, Paul Robeson's long ahead of your time, but anyway, he after all of that abuse he took for the 6 decades, he had a lot of depression and he had electroconvulsive treatments as well. Well, it's the largest group we've had in quite a while, so thank you all for participating and attending. Any additional comments? Charles, hey, it was good to see you back again. We missed you. And the rest of you, good to see you. Camilla. Yeah, Camilla, welcome. Good to have you on today, Camilla. Thanks for joining. Did you have any comments you wanted to share with us, Camilla?
No, this was very informative. Thank you for the invite.
Oh, well, thank you for joining us. Okay, any closing comments?